Bright Tuty. Every student matters.
Next topic is symptoms and signs of the disease. What does a disease look like? If a person has a disease, that means some of his organs or tissues are not functioning properly. So there will be certain symptoms in the body. Symptoms indicate the presence of some disease. For example, cough, fever. One symptom can be for a number of diseases. Let's say cough. Okay. If a person has cough, it could be because of some infection in the throat or infection in the lungs, or maybe some allergy in the throat. On the other hand, if there is fever, it could be because of the person went out in the rain the other day, change of temperature, or maybe some bacterial infection in the blood. So one symptom can be actually because of a number of diseases. Then these are symptoms. What are signs? Based on the symptoms, signs provide information about the presence of a particular disease. Sign is for a particular disease. They are different for each diseases. For example, swollen liver or increased sugar level in the blood. So if there is any symptom like cough or fever or headache, you go to a doctor. Then what does doctor do? Doctor checks your body, like he'll check your pulse rate, or he'll check your heart rate or anything like that. He actually is looking for signs, because the sign will actually indicate a particular disease. Sometimes doctors also prescribe you to go for certain blood test or urine test in the laboratories. This will actually make him understand what kind of a disease do the person have. The symptom can be for one symptom can be for any number of diseases. Many diseases can have a common symptom, but on the other side, sign is for a particular disease. What we feel is symptom, and when we go to a doctor looks for the signs. Okay, I hope it's clear to you. Next, there are two types of diseases. Okay, acute diseases and chronic diseases. Acute diseases that last only for very short period of time, they are called acute diseases, like common cold, malaria, typhoid, etc. So they initiate, and then there are certain symptoms, you take the treatment and you are cured after the treatment. So for a shorter duration of time, such diseases are called acute diseases. On the other hand, there are chronic diseases. These diseases which they last for longer duration of time and sometimes even for lifetime. They are called chronic diseases. For example, diabetes, hypertension, AIDS or cancer. So once such a disease occurs, it takes a lot of time to cure. Even after the cure, sometimes the symptoms they pertain, organs are not fully recovered. Such diseases are called chronic diseases. Chronic diseases and poor health. If a person is suffering from a chronic disease, even after the cure, he might feel some prolonged illness, some changes in the body, like it will lead to prolonged general poor health after a chronic disease. There is drastic long-term effect on the health. Unlike acute diseases, there is no long-term effect, but in chronic diseases, there is a long-term effect. For example, tuberculosis. So it leads to weight loss in the weight and fatigue. The person feels tired all the time, even after the cure.